Welcome back, Ira and
Leah again.
and we've got Dr. Rene Loyola again with us this morning for his second appearance
Yes.
from Blush Aesthetics. And today he's going to focus primarily on his weight loss program that he's offering to his patients. And we asked him here to share that with us because we thought you, our audience, would be interested to know what Blush is doing with regards to weight loss. So good morning.
Morning. I mean, obesity is such an amazingly prevalent thing. 1 billion people in the world are obese.
Yeah.
And this country, actually, I thought would be much worse. It's number 15 in percentage of obese people. But in numbers, is number 1 in the world. And how do you determine whether somebody is obese or not? You use BMI, which is very, not very specific. I mean, I am considered almost overweight based on BMI. That's crazy. But if your BMI is 18, you're underweight. If your BMI is 19 to 25, that's considered normal. 25 to 29 is overweight. 30 to 39 is obese. And anything over 40 is super obese.
Yeah, morbidly obese.
Well, yeah, that's...
And we've seen patients with BMIs in the 80s.
Jeez. I don't think I've ever seen anything like that.
Right.
That's brutal.
These are the morbidly obese patients that we see occasionally. The patients that literally have their own zip codes. I mean, they're big
Well,
people.
that person cannot be helped with anything like this. That person needs surgery. But having been a surgeon for 40 years, I would tell my patients routinely, do not have surgery if you can avoid it. So if you're obese, or maybe a little bit on this super obese, no harm in trying this, because I have a couple of people that have lost a lot of weight on this.
So because you started with that, how much of obesity do you feel is behaviorally related?
That's a whole subject for almost a complete talk. There are so many things. There are genetic components. I mean, if you may be predisposed to be obese, that's a bad problem. But a lot of it is behavior. We live in a country where fast food is the cheapest thing. We have single parents. They have to put food on the table. What's the best thing for them? It's that. So you have kids that are sitting at home because the parents are terrified to let them get out of sight. When I was a kid, I would leave my house at 8 o'clock in the morning, come back for dinner. My parents would just show up for dinner. I was running constantly, doing something. Now, perfect storm. Kids sit at home all day on the computer. They eat fast food. So 75% of adults in the United States are overweight. Of those, 40% are obese and 10% are super obese.
Wow.
Adolescents from 2 to 19 are 20% of them are obese.
I like to tell my patients, and Leah does as well, that it's a math problem. It's all about calories in versus calories out.
Yeah.
And if you consume more in than you're putting out, you're going to gain weight.
Right.
Well, this is the thing about these medications. People say, well, and we'll talk about them in a little bit, this is not a panacea. You can't just take these medicines and expect to be, wow, I'm going to become slender. It is a 3-prong approach.
Right.
You need to exercise more, like you said, the balance of calories in and calories out, and you need to learn how to eat. To me, the biggest thing is, I don't have this svelte body for nothing. I'm an old person, and I work at it. And to me, the thing that works best is portion control. If I go to a restaurant,
I'm not taking my clothes off on the show, guys. I
just open them up.
So weight loss seems to be the hottest topic in both medicine and aesthetics. So can you give us an overview of the most commonly used weight loss medications? I know some of them like Semaglutide, Tirzepatide, and tell us how they work in the body to promote weight loss.
Well, those are the two better known ones, and they have different names, Ozempic, whatever. They have a 3-way that they affect your body. They affect you at the level of the pancreas, which controls your blood sugar. So it makes the pancreas secrete more insulin. It lowers your blood sugar. People that are normally hypoglycemic need to be careful with this. They really should not take them. It works at the level of your central nervous system. It tells your body that you're not hungry. So their appetite goes way down.
We call that decreasing food chatter. You just don't think about it.
Well, except you don't feel it. It's like, yeah, I'm hungry, but... And the other thing is, it works at the level of your stomach. And it slows down the emptying of the stomach, which is one of the causes of the major side effects that these things have.
Right. Which is why we tell patients who are about to have surgery to stop it 1 to 2 weeks prior.
Yep. But, I mean, they work.
Yes.
There's no question about that, but they do have side effects. And the biggest ones are gastrointestinal. They get nausea, diarrhea, vomiting, constipation.
Right.
They can get badly dehydrated because they lose their appetite, so they not only eat, they don't drink enough fluids.
Although I've seen it work the other way. I've had several patients on semaglutide and tirzepatide that have developed diarrhea.
Oh, yeah, yeah,
Yeah.
both. But they can actually, I've seen a couple of people that have shown into the ER with an impaction because they get so dehydrated, bowels can't move.
I actually have a patient who has IBS but diarrhea, and they are on a weight loss medication and actually corrected it. So it kind of counterbalances.
Everybody
it
is
a little
affects
bit
everybody
different.
differently.
Everybody's different. So, but the thing is, this is not for everyone. There are
Right.
some absolute contraindications. If you're allergic to it, bah. If you have had, or anyone in your family, a specific type of thyroid cancer, which is medullary thyroid cancer, you can't take this. Pregnancy and breastfeeding, and to me, a person that has gastroparesis,
Right.
which, as you know, is a disease that normally makes your stomach empty slower. If on top of that you add a medication that's going to empty even slower, I think that's terrible.
Right.
Not to say pancreatitis, to me that's a relative contraindication. You have to watch those people very carefully.
And then there's the rare syndromes like multiple endocrine neoplasia type 2.
But that's part of the thyroid
Yeah,
cancer.
exactly.
But how
I mean, have you ever seen it?
twice in my
Yeah,
life.
I've seen it once.
And they teach it to you
40
all
years
the
I've
time.
seen it once.
It's ridiculous. But yeah, but they said the cancer is the issue.
Right.
And renal function, you got to watch these people carefully and monitor them. But they work.
So walk us through a typical weight loss journey when someone comes to Blush Aesthetics and what that consultation looks like, ongoing support, how you kind of help them throughout.
What I do, I meet with them, and I trained in a long time ago, and maybe we were taught that you do a full-fledged history and physical. And it's very important because you got to find out things that might make them not be able to take the medication.
You'll always find out things through those, right?
You have
Patients
to.
at the very end will then tell you
But
about
these
a
days,
history
yeah.
of something.
These days, doctors get a terrible history.
Yeah.
They don't even examine their patients.
Yes.
I do a physical exam. It's not that critical, but I do it. But the history is critical.
Yeah.
And then we draw their blood,
Sure.
send that off. You mind you see that? Because you can be hypothyroid and be overweight. You correct that, it goes away. So you check their thyroid function, the liver test, kidney function, and if everything checks out, they're ready to go.
Well, for those of us that have treated obesity for many years, there's an endocrinology line that I like to use because patients will always come and tell me, I've always been fat, I'm big boned, and I think I have a glandular problem.
They love that.
And my answer to them, if the fork were a gland, everyone would have a glandular problem. Okay?
No, there is some genetic predisposition, but the
There is.
glandular stuff,
Right.
I don't buy into it.
Right.
But why is obesity so important? Because it has terrible repercussions. I mean, it can shorten your lifespan if you're really morbidly obese. Cardiovascular issues, heart attacks, congestive failure,
Sure.
strokes. Think osteoarthritis. Go to the gym, pick up 2 50-pound dumbbells, and walk around for a little while. That's a lot of weight. It destroys your joints. And think of the stigma of obesity. This is an important part that a lot of people are not aware of. They're aware of it, but they don't think of it. They're stigmatized. If somebody is obese, people will look at them and say, this person maybe is dirty, or maybe they smell, or they're not as intelligent as somebody else, which is completely wrong. But it's human nature.
Right.
So it causes major depression and social isolation.
Right.
So if you can get them to a point where they feel better about themselves, they'll function better.
So the meds assist in weight loss. They don't cause weight loss.
Well, they do, to a certain
Well-
extent. To a certain extent.
Okay.
But if you don't do the other things, forget it. It's a three-pronged approach. But from the medication, if you do the other things, you can expect to lose anywhere from 15 to 25% of weight.
Let's talk about those other things in addition to the meds. And I want to focus just for a second on diet, because what you eat is very important. What do you do for your patients as far as guiding them through a course of diet, nutritional counseling?
Like I said,
Percent.
number one to me is portion control, I'm telling you. Now, it's hard sometimes for people to give up something that they absolutely adore. So it tells me if you have the fortitude to say, okay, once a week, I am going to have a key lime pie. You order it, you get 2 bites of it, and you put it away. You have to be able to say no, because you can't be too draconian, otherwise people are not going to do it. But super saturated fats, fast food, food and drinks that are very rich in sugars, those things are bad for you. So, but moderation. If you try to do it too hard, they're not going to do it.
Right.
Do you have your patients count calories?
No. I weigh them every week. And I don't have them count calories. I mean, how dreary is that?
Well, it's kind of a guideline, though. It's like diabetics checking their blood sugar. It puts them in control of their disease.
But how many people do you have to count their calories?
Very few.
It's about compliance, yeah.
Right.
If it's about, this makes it easier for them to deal with it. But if they don't do the others, forget it.
So how about fill up your plate, put half of it back.
I do.
And don't go back for seconds.
I know what I ask every time I go to a restaurant. I would say 90%. I ask for a box.
Those portions are huge.
I ask for a box, and immediately I divide it in half, put it away. That way your brain sees only this. So if you're gonna say, well, I'm gonna eat half of it and be done with it. Bull, because you're gonna eat more.
Right. And let's talk about the confusion between thirst and hunger. Most people, when they feel empty, they eat something. But what about if they drink something? What about if you start each meal with 8 ounces of water?
Fills your stomach.
It fills up your stomach, so you're going to want to eat less. And there are little tricks like that I like to use. What tricks do you have?
The other thing that is very important, I mean, the portion control
Sure.
is critical. Stop eating before you're full. If you eat to the point that you're full, you have overeaten. So I always stop and just, I'm still hungry. In about 5-10 minutes, it's gone.
Right.
Sometimes I'll go home. Like these days I'm having for lunch, maybe a Boost and yogurt. And I'll get home, let's say whatever time, and I'm hungry. But get a couple of crackers with cheese, not many, 2, 3. And in 10-15 minutes, my hunger has just abated. Then I eat small later on. I never overeat, never.
Right. So some people worry about weight, like regaining the weight back after stopping this medication.
Yeah.
So tell us how you guide patients through long-term results that are sustainable.
There's a definite truth to that rebound weight gain. And what I've been doing lately is just getting them to the maximum dose, what they're happy with, and once they reach their weight that they want to lose, and then start bringing down the dose. If you can find a happy medium, less dose, and then they don't gain any weight, but they're not losing any more, then I stop there. Now, some people need to stay on higher doses indefinitely.
Last question.
Yes,
And we're going to bring you back for
Yeah.
another show.
love it.
But Blush Aesthetics is known for luxury and innovation. How have you integrated the medical side of weight loss with your cosmetic treatments for a more complete transformation of your patients?
Well, having been a surgeon and a doctor for so long, I think I have a little bit of an extra edge in that I'm more aware of health issues. Like specifically with the weight loss, I monitor these people. I look at them, talk to them. Plus, I think it's just more of a complete understanding of the human body. I mean, some people walk in and they want, let's say I want Botox. No questions asked. Come in. They don't even tell them what they're doing, how it works. I spend time with my patients. I explain to them what this is going to do for you. And the concept of, we'll talk about the next time maybe, facial restructuring. The fact of what you can, it isn't just about Botox or just about filler, is making that person seem beautiful and happy with themselves. And less is more.
Less is more. And we're out of time, but thank you for coming today.
Loved it.
We'll be back soon on another episode of Preserve Health Talks.